This is a behavior support plan designed for Charlie Benson. He is a 3-year-old male who was diagnosed with autism spectrum disorder. Charlie was referred for ABA services after receiving his diagnosis of ASD on May 5, 2013. He communicates via a picture exchange system and has minimal vocalizations. He recently is vocalizing more often so that the team is now accepting more vocal approximations when manding. He still needs prompting to use picture exchange to communicate and man for items. The parents have recently wanted to work more on daily living skills, especially using utensils for non-finger foods during meals. For this behavior support plan, there are 3 target behaviors, which include utensil banging, independent utensil use, and bans. Utensil banging is any instance or attempt of Charlie holding his utensil and hitting it against a surface or another item. Examples of this are hitting the utensil against the table, hitting utensil against a plate, hitting it against a chair, or hitting it against a wall. Independent utensil use is defined as picking up the utensil and utensil picks up or scoops food without the use of fingers. A mand is defined as any vocal approximation or picture that is handed to another person. When Charlie sits at the table for a meal, Charlie is likely to engage in utensil banging because past behaviors of utensil banging were often reinforced with parental attention. 2 functional assessments were completed. The FAST screening tool was completed and an functional analysis interview was completed. According to the FAST, utensil banging is maintained by social, attention, or preferred with 75% of potential source of reinforcement, and social, escape from tasks and activities with 50% of potential source of reinforcement. According to the FAI, utensil banging will allow the client to gain access to parents' attention in the form of reprimand and asking if the client would like more food. Goals of treatment include decrease utensil banging, increase independence with utensil usage during meals, and increase manding for items, attention, and activities during mealtime. During baseline conditions, for 3 consecutive days during dinnertime meals, Charlie engaged in an average of 20 occurrences of utensil banging during the meal, which on average, the meals last 30 minutes and 26 seconds. The short-term goal is that Charlie's utensil banging will decrease by 50% in occurrences during meals from the data recorded in baseline, and this will happen within 2 weeks of the introduction date. Then the long-term goal is that Charlie's utensil banging will decrease by at least 95% of occurrences during meals from the data recorded in baseline across 2-week period. Charlie will work on independent utensil use. During baseline data, it was recorded for 3 consecutive days during mealtime. Charlie needed an average of 12 prompts to correctly use his utensil instead of using his fingers. The short-term goal is that Charlie will independently use the utensils when present with non-finger foods with 6 or fewer prompts across 3 consecutive days. The long-term goal will be that he will independently use the utensils when present with non-finger foods with 2 or fewer prompts across 2 weeks. Staff and parents will be working on increasing mans during meals. During baseline, which was recorded for 3 consecutive days during dinnertime meals, Charlie independently manded for items using picture exchange or vocal approximations an average of 0 times. The short-term goal will be that Charlie will independently man for items, activities, or attention using picture exchange and/or vocal approximations an average of 6 times during meals across 3 weeks. The long-term goal is that Charlie will independently man for items, activities, or attention using picture exchange or vocal approximations an average of 12 times during meals across 2 weeks. First, I would like to go over some antecedent manipulations. These are strategies that are proactive and you can implement before the problem behavior occurs. The 3 antecedent manipulations that we will be using for the utensil banging behaviors include non-contingent reinforcement procedure, modification of establishing and abolishing operant, and functional communication training. During baseline, Charlie engaged in an average of 20 occurrences of utensil banging during an average of a 30-minute meal. Since the behavior is maintained by social reinforcement according to the FAST, each occurrence of utensil banging acted as a mean to gain social reinforcement. During baseline, Charlie appeared to need social reinforcement or attention every 1.5 minutes. The reinforcer that we will use during this NRC procedure is the parent or therapist will give attention in a form of specific praise. In other words, good sitting at the table, you're doing a good job with your fork. Look at you eating, Charlie. And then prompt him to request for more items. For example, show him the picture book and state, what do you want more of? The NCR interval will decrease by each week. So in week 1, give attention on a fixed time interval of 1 minute during the meal. Week 2, give attention on a fixed time interval of 2.5 minutes. On week 3, give attention on a fixed interval of 4 minutes. And on week 4, give attention on a fixed interval of 5.5 minutes. How you will do this NRC is you will set a timer for 1 minute, and then when the timer goes off, you will turn and give that social reinforcement to Charlie. And here is a video on how to complete that procedure.
Nice using your fork. Good job. What do you want more of? Sweet potato. Good choice. There's more sweet potato.
As you can see from the video, as soon as the timer went off, the therapist turned to Charlie and gave some specific praise. And then turned the communication book closer to her and offered, what do you want more of? But what if the problem behavior of utensil banging occurred while the NCR interval ended? So if Charlie engages in the target behavior, utensil banging, when the interval has ended, continue with the reactive strategy. Once Charlie is back to eating and not engaging in maladaptive behavior, wait 3 seconds, give the social reinforcement, then start the next interval. This will be demonstrated later in the presentation after we go over the reactive procedure. Another antecedent intervention that we will focus on is modification of establishing and abolishing operants. For the abolishing operants, we will use plastic silverware instead of metal silverware during this intervention. This can alter the effectiveness of the reinforcers that are maintaining the utensil banging behavior. In other words, plastic silverware is softer than metal silverware, which will help control for the reactions from the parents and help minimize and better manage their abilities to withdraw attention as a consequence for the banging of the utensil. This also reduces the potential for property damage that could occur. For the establishing operant, we want to give smaller portions of foods in order to create states of deprivation and increase the likelihood that Charlie will demand for more of an item that he would like. The next antecedent manipulation that we are going to learn about is functional communication training, or FCT. We want to prompt and reinforce the use of picture exchange and vocal approximations to requests for items, attention, or escape. This will be helpful in extinguishing the problem behavior by presenting an alternative behavior to gain that attention and access to the items that he needs. In order to make functional communication training effective, we must first discover the behavior chain. So during the FAI, parents reported that Charlie will engage in random nonsense vocalizations frequently before engaging in utensil banging during mealtime. Therefore, when Charlie engages in random nonsense vocalizations that are not clear, you may want to present the discriminative stimulus, "What do you want?" and move the communication book near Charlie and prompt him to make a choice from the array of break, food items available for dinner, and attention-related activities like hugs or kisses, attention from mom, etc. The next step in making sure that functional communication training process is effective is to have a continuous schedule of reinforcement. In other words, parents and therapists will want to reinforce Charlie with the item or activity he manded for each time he mands for it. We will plan on thinning out this schedule of reinforcement when he meets his long-term goal, but until then it should stay on a continuous schedule of reinforcement. Next, you will see a video of staff members working on functional communication with Charlie, where they discover the behavior chain in which Charlie is making nonsense vocalizations and then prompt him to use his communication book to man for the item that he would want, and then reinforce with that item after the mand immediately.
What do you want? Juice. Good job, Juice.
As you could see in the video, the therapist used a vocal prompt, "What do you want?" In order to make sure functional communication training is effective, we must decrease verbal prompts. Therefore, after 2 weeks, and if the short-term goal is met for manding, fade the vocal prompt of "What do you want?" Instead, use less intrusive prompts, such as positional prompts, in other words, moving the book closer to the individual, and a gestural prompt, for example, pointing at the book. We want to decrease the response effort for manding, so be sure to always have the communication book readily available at the table during meals. Next, you will see a video where the therapist fades that vocal prompt.
Shrimp. Here you go. Here's some more shrimp.
Now that we covered all of the antecedent interventions in which we can complete, we are now going to move on to reactive strategies for responding to the problem behavior. So if Charlie engages in utensil banging, first drop eye contact. Then remove the utensil from Charlie's hand. If Charlie engages in screaming, whining, or screaming after removal of the utensil, wait until he is calm. In other words, not engaging in crying, whining, or screaming for at least 3 seconds in duration. Once he is calm, place 2 to 4 known tasks for Charlie to complete. For example, touch nose, imitate waving hand, finding arm. These known skills and tasks should be skills that are in his repertoire and that he has mastered previously. The next thing to do is give Charlie access to the utensil again, and then present the discriminative stimulus, "Let's eat." Next, you will see a video of staff implementing the reactive strategy for utensil banging with Charlie.
Try this. Do this one. Good job. Try this. Touch head. Good touching head. Let's eat. Good eating.
So if Charlie engages in the target behavior, utensil banging, when the NCR interval has ended, in other words, the timer has gone off and you want to reinforce with some social attention, continue with the reactive strategy. So remove the utensil, place the known demands, give back the utensil, etc. Once Charlie is back to eating and not engaging in maladaptive behaviors, wait 3 seconds. Then give the social reinforcer used in the NRC procedure, and then start the next interval. Next, you will see a film of the staff completing the reactive procedure when the NCR interval goes off and the target behavior occurs.
Do this one. Where's arm? Good job. Try this. Do this. Awesome. Let's eat. Good eating. Is there something you want more of? Asparagus. Good asking.
There is a chance that extinction bursts can occur and other new maladaptive behaviors could occur from the response blocking and removing the utensil during utensil banging. So if Charlie engages in aggression, which is more than likely to be hitting, block attempts of aggression. Continue to follow through with the reactive strategy for utensil banging once he is no longer engaging in aggression for at least 3 seconds. If he engages in screaming, wait until he is calm, in other words, not screaming for at least 3 seconds in duration, and continue the reactive strategy for utensil banging. It is possible that Charlie could engage in elopement. Block responses of elopement to leave the meal area and redirect him back to the table using least to most prompting procedure. And then continue with the reactive strategy for utensil banging after 3 seconds of no maladaptive behaviors. The reasons for using these antecedent procedures is that the non-contingent reinforcement procedure was put in place because the FAI and FAST indicated that utensil banging was maintained by social reinforcement. The utensil banging was occurring at a high rate during mealtime, and according to the FAI, parents reported the utensil banging occurred at higher frequencies when both parents were at the table and conversing. The NRC procedure was put in place as an antecedent intervention to help reduce the motivation to engage in these problem behaviors. So, in other words, Charlie was getting attention every time he would bang a utensil against a surface, and he liked that attention, so he would continue to do it. So we developed the NCR, which gave attention on a fixed interval so that he was less motivated to engage in that utensil banging. Along with the NRC, functional communication training was implemented. This helps give the individual an alternative mode of communication. The functional communication training was incredibly helpful with reducing utensil banging because before the interventions, utensil banging was a way to gain access to parental attention and preferred items. After the intervention, utensil banging has ceased and functional communication or manding at mealtime has increased. Simple environmental manipulations such as making the utensil plastic instead of metal alters the effectiveness of the reinforcer. This means that the parents are more able to remove their attention and use the reactive strategy proposed appropriately, since the likelihood that the plastic will cause property damage is less compared to a metal utensil. Antecedent interventions are important because they may help decrease the frequency of maladaptive behaviors and decrease the frequency that more intrusive reactive strategies are used. In other words, these simple environmental manipulations such as using plastic instead of metal, implementing non-contingent reinforcement procedure and honing in on functional communication is really important in that it can decrease the maladaptive behavior, and it can also, decrease the amount of times that you have to use that reactive procedure of taking the utensil away and presenting all the tasks, then giving it back. So it's really helpful in keeping the staff and parents safe, and also really helpful in decreasing the amount of property damage that could occur from the maladaptive behavior. So that is everything on how to do the behavior support plan for Charlie and helping the family really work on eating meals.